This conference will now be recorded.
Hello, can you all hear me?
Yes, sir.
Okay, and can you
Yes,
see
sir.
the presentation?
Yes, sir.
Okay. Okay, we are around 21 people, so probably we can wait for some time, maybe another 2 minutes, and then we can start. Okay. Okay, so today we are going to start with the homeopathic part of the program. As you know that we are going to do some homeopathic therapeutics and homeopathic management of various cosmetological and dermatological disorders also. So thank you, Prajakta. So the first thing I want to ask is, and I would like everybody to share is, are you all of you using homeopathy or only few? Can you please talk somebody that are you able to use homeopathy or is it only general practice? Dr. Dimple,
Yes, sir. I am practicing purely homeopathy.
very good, very good. So do you think by doing this cosmetology course you will be able to help people in cosmetologic and as well as homeopathic way, right?
Yes, sir. Definitely.
Because that is, yeah. So yes, Dr. Pramila, please tell me, Dr. Pramila. You can unmute yourself and tell me. And please come on the camera. So let me see everybody, okay? When you're talking at least.
मी
Dr.
जीपी
Pramila.
करते सर होमिओपॅथी नाही
हा
करत
जीपी करते व्हेरी गुड हरकत नाही काय त्यात काय प्रॉब्लेम नाही आणि इनफॅक्ट जीपी करताना आपल्याला पेशंट जास्त दिसतात वी आर एबल टू गेट मोर पेशंट्स बट देन आय वुड
हो
लाईक टू मोटिवेट ऑल ऑफ यू की तुम्ही इव्हन जीपी करत असला तरी तुम्ही कुठे ना कुठेतरी होमिओपॅथी करा काही ना काहीतरी करा थोडं तरी आपण जे होमिओपॅथी शिकलो ते कुठेतरी वर्क झालं पाहिजे जीपी करणं एक गरज असेल किंवा आवड असेल इट इज ऑल ओके बट आपल्या होमिओपॅथीमध्ये खूपशे फायद्याच्या गोष्टी आहेत कॉस्मेटॉलॉजीमध्ये डर्मॅटॉलॉजीमध्ये मध्ये आता डर्मॅटॉलॉजीमध्ये वगैरे ॲलोपॅथी एवढं वर्क नाही करत कॉस्मेटॉलॉजीमध्ये एवढं नाही करत जेवढं होमिओपॅथी करतं सो आय थिंक इवन इफ यू आर डुईंग अ जनरल प्रॅक्टिस इट इज गुड बिकॉज यू विल बी एबल टू सी मोर पेशंट्स अँड त्यामुळे तुम्हाला जास्त होमिओपॅथी करता येईल ओके
हो थँक्यू सर
गुड गुड डॉक्टर गीता डॉक्टर गीता
Yes,
जोग
sir. Yes,
या
sir.
टेल मी अबाउट युअर प्रॅक्टिस मॅडम काय करता तुम्ही
Sir, I practice I practice homeopathy and allopathy both. So like
व्हेरी
acute cases also like if for example if a patient has an injury, blunt injury or anything, so I prescribe I don't prescribe. I only make the medicines and give the homeopathy remedies for the acute for chronic otitis or any kind of melasma also mild melasma started like a sepia and everything or for the acute problems acute remedies and it works wonder for the skin also like for the diaper rashes or anything so I do practice.
very nice, very good. And Dr. Prajakta, can you hear me now? Because Prajakta is saying not audible. Can you hear me, Prajakta?
Yes, sir.
Sometimes there are problems with a little bit with internet, so kindly see your internet connection, or maybe what you can do is you can leave and then join again, something like that. So many times possible.
Yes, sir. Yes, sir.
Hmm. And one more thing
Yes,
is
sir.
when I mean, please keep yourself muted because I can see some child. So I think it is Prajakta. You're unmuted. Please mute yourself.
Okay, sir.
Okay. Dr. Varsha. Okay, fine. Okay, so I think we can start our lecture today. So today we are going to take a very, very common topic, which I'm sure you all of you know. And the other day we did pigmentary disorders. So we talked of two important things: hyperpigmentation and hypopigmentation. And as far as even Dr. Manisha told us the other day, Dr. Manisha Sani told us that as far as cosmetology is concerned, we have a lot of scope in hyperpigmentation. But as far as hypopigmentation, we can't do too many things in cosmetology. But unlike that, homeopathy has an excellent scope both in hyperpigmentation and hypopigmentation. So we'll have to think of homeopathy when a patient of hyper or hypopigmentation comes with us. So whatever cosmetology we are going to learn, along with that, if we apply homeopathy, I'm sure of 100% success. Remember that. Because with cosmetology alone, there might be some success. With homeopathy, there might be some success. But if we combine both of them, there will be enough success. And I'm sure that the patient will be really happy. And ultimately, our aim is that the patient should be satisfied. It's very, very important. Second thing is wherever possible, of course, cosmetology, we're going to learn everything about peels and everything about, microdermabrasion and everything, even lasers. As far as possible, when we are using homeopathy, homeopathy always helps. Remember that. Homeopathy always adjuvants. So many of the effects and side effects of any cosmetological procedure also can be taken care if we keep homeopathy along with this. That's very, very important. So I would advise all of you, those who are doing homeopathy, it is good, but those who are not, please keep a minimum kit of homeopathic medicines with you in your clinic by your side, even when you're seeing patients, even when you're giving allopathy, just keep a kit there. That kit will always take care of you. Remember, whether the kit is used or not used, but just keep it there. It will help you. Okay, so hyperpigmentation and hypopigmentation. So basically, when we talk of hyperpigmentation, we talk of the most important thing is post-inflammatory hyperpigmentation, and the second thing is of course melasma. So melasma is a very, very common thing that you see in the practice nowadays because of the changing weather. Remember, the sun is so strong nowadays that most of the people, most of the ladies, most even males, you see. The other day we also did this lactic acid peel on my own face. So I have this melasma for a long time. But remember, after taking homeopathy, it has reduced much more because this is the first time I did some peel on my face. I have never used any peel, and I was the first sample that day for all of you. But the most important thing is that even without using any cosmetological procedure, I was able to get rid of my melasma only with constitutional homeopathy. Now, constitutional or specific or therapeutic, we'll have different things we'll be learning a lot today. We'll be talking about all those things. We'll also learn about why the face is affected, remember. So there is something called psychodynamics. I don't know whether you have come across the term psychodynamics, metaphysical cause, biogenealogy, or something like that. That why a particular organ or why a particular part of the body is selected. Are you all getting it? Because when we talk in materialistic terms, we are talking of sun, we are talking of cold weather, we are talking of hot water, all those things, right? Change of weather and all that. But when we think dynamically, when we think homeopathically, we know that it is the whenever we are affected emotionally. Remember, first, shock or the trauma to the system is emotional affection, and when you are affected emotionally, then ultimately the disease, as it starts developing, it gets localized to a particular organ. Now why face? So why face is affected, that is very, very important. Of course, that is, we will go too much deeper into homeopathy and psychodynamics if we think like that, because this the PPT is not started Vivian yet. It is just Batra's homeopathic way only. It's nothing has started it. I have not started. I'm just trying to introduce. So don't worry. I mean, just listen to what I'm talking. I mean, that is more important than the PPT. If you are able to understand what I'm talking, I think that is better than the PPT. So I'm just telling you my experiences that why when I look at a patient and when a patient comes to me, I will first think that why is this patient come to me with the melasma, number one. I won't look at melasma. Yes, as a homeopath, as a doctor, I will say, yeah, melasma, and I'll think of epidermal, dermal, mixed melasma. I will try to find out what is the cause. All these things, the doctor within me is going to find out. But at the same time, also the homeopath within me is going to try out and think out कि इस आदमी के चेहरे को ही क्यों फर्क पड़ा है? Why not his hair? Why not his hands? Why not his legs? यहीं पे क्यों हुआ है उसको? So what is the language of vital force? This is the language of vital force, and this is bio psychodynamics. That what happens? Why is the face selected in this lady or in this male? That is very, very important. So there has to be some event, there has to be some conflict, there has to be some trauma, there has to be some emotional damage somewhere before the onset of all these problems. And if you think of problems like this, I'm sure using cosmetological procedures, as well as homeopathy in such a way will really help you a lot in your practice. That's how it has helped me. Of course, I don't practice cosmetology. I am very new to all this. I am also learning every time with you. But as far as homeopathy is concerned, I can share my experiences with you. And this is a lecture on homeopathy and cosmetology. So I can always, correlate cosmetology and homeopathy in that way. And I hope you'll understand and you'll like it. Okay. So let us talk about pigmentary disorders. Facial pigmentation refers to brownish yellow discoloration on the face. Now, the color to our skin, we all know, is because of melanocytes. The melanocytes in the epidermis, in the lower part of the epidermis, the layers, the epidermis, the dermis, and the hypodermis, right? The subcutaneous tissue, all these layers. So melanin, which is secreted by the melanocytes, normally gives the color to our skin. And this melanin, of course, is less in fair people, and therefore you see more of these freckles, more of these blemishes in fair people rather than brownish kind of people like us Indians or Asians, right? So facial pigmentation refers to brownish yellow discoloration on the face. The discoloration results from overproduction of melanin pigment by the melanocytes. Right in the beginning here, you know that the miasm is psychosis because it is overproduction, remember. So whatever remedies that you will select or think of homeopathically will have to be psychotic in nature. Remember, therefore remedies like thuja, okay, remedies like thuja, remedies like dalkamara, remedies like lycopodium, remedies like sepia, remedies like magnesium carb, they all belong to predominantly psychotic methods. And right from the beginning of first year BHMS, we know that overproduction, overgrowth, anything more than required is psychotic medicine. So the discoloration results from overproduction of melanin pigment by melanocyte cell. What is the cause of this overproduction of melanin? The commonest cause is sun. Remember, the commonest cause is tanning, that is the overproduction of melanin by melanocytes. Now there are three types of basic pigmentary disorders. If you look at basic, there are only two: hyperpigmentation and hypopigmentation, right? In hyperpigmentation, as I have told you, there is a post-inflammatory hyperpigmentation. There could be melasma, chloasma, freckles, blemishes, all these things. Post-acne, remember, whenever we have acne, we know that when we tend to pick the acne, it leaves behind a dark blemish, right? Sometimes there is a scar, sometimes there is actually a hole which is created, and that's where our cosmetology really helps, because as homeopaths we have a limitation there. Whenever there is a scar, whenever there is a scar formation here, when the patient comes and says, I have these scars, I have these, big scars everywhere, because in the young age I used to pick my pimples, pus used to come out, right? So Sulakshana, I think again you'll have to see your internet. Am I audible to everybody?
Yes, sir.
Okay.
Yes, sir.
So please, where I'm not audible, please check your internet or please leave and again join back. That will help you. Okay. When we talk of hypopigmentation, you'll have to think of two or three things. One is also you have to look at the age. Remember, when you look at the age, when a young chap or a young boy comes to you or a young girl comes to you with a whitish pale, spots here and there, or maybe a diffuse patch, it could be pityriasis alba, remember, or tinea alba. At the same time, if the same person, if the same patch like that is coming at around puberty age or later, it could be tinea versicolor. As versicolor says, various colors. Remember, it's a fungal infection, of course. And many people have it on the neck also, on the back also. In Marathi, we call it shiver, right? And many a times, even seborrheic dermatitis accompanies this. So a lot of dandruff, and the dandruff particles they form here, they fall on our shoulders, fall on our external part of the chest and the back, causing a lot of pigmentation there. So that is tinea versicolor. At the same time, there could be something called vitiligo also, which you know, vitiligo is depigmentation. So all of you should know what is hypopigmentation and what is depigmentation. Hypopigmentation is always something like a diffuse thing. Remember, depigmentation is actually milk-like appearance, milky appearance. And when you say vitiligo, it is never ever congenital. Remember, it is always acquired. You should all remember that. That somebody saying की मला हा पांढरा डाग लहानपणापासून आहे, झाल्यापासून आहे, so it is not vitiligo. Remember, vitiligo is always acquired. Okay, and it is an autoimmune disorder where the melanocytes are destroyed, and therefore our miasm becomes syphilis. So your drug selection should be according to that. Remember, because when I'm talking about miasm, you will think that, "Arey sir, kaha itna homeopathy mein ja rahe hain? We are interested more in cosmetology." But I want you to collaborate. I want you to marry homeopathy and cosmetology together so that your results are excellent. Remember, we should not look at results which are 10%, 20%, 50%, but we have to look at 100% where the patient is completely satisfied. Remember, okay? So we are looking at hypopigmentation. We thought look at a spectrum of depigmentation and hypopigmentation. So from hypopigmentation, if you start, you got tinea versicolor, tinea alba, also all types of tinea corporis, and where there is hyperpigmentation. Remember, because of too much scratching, fungal infection, people scratch a lot, especially in the groin region or anywhere on the skin. So tinea corporis, tinea cruris, tinea capitis, tinea pedis, athlete's foot, all these things. You all know that. Even the nails are affected in fungal infection. You know that. Now, nails itself is a very, very important thing that you should know, and you should really know the repertoire when you are talking of nails. Because if you open the repertoire and look at all the different types of nails and nail disorders and nail discoloration, you'll understand that today's field is of lot of manicures and pedicures. People are spending lakhs and millions of rupees in making their nails proper, artificial nails, even natural nails. So you should, with homeopathy, I have seen in my last 28 to 30 years of practice, that the right indicated remedy, which is not only acting on the whole individual, even the nails become very, very nice. The nails which were brownish in color, the nails which were crumbling, the nails which were brittle, and allopathic, we are giving lots of calcium to the patient, and what all we give to the patient. But the right indicated homeopathic remedy can bring back the normal pinkish color of the nails back with the normal texture. Even if it is rough, corrugated nail, breaking easily, brittle nails, all these kinds of nails, we have thuja, silicia, graphites, all these remedies, they are wonderful remedies to bring your nails back to normal. Remember, okay? So when we are looking at pigmentary disorders, basically of the face, we are looking at chloasma, freckles, and blemishes, right? This is the broad classification. You look at chloasma or melasma. Now, is chloasma same as melasma? Yes, many times we talk of chloasma and melasma as interchangeable, but chloasma or melasma are patches of dark skin that appear on the areas of face exposed to sun. They are commonly seen in pregnant women, women taking birth control pills, which itself tells us that it is estrogen dependent, remember. Okay? And women taking hormonal replacement therapy during menopause, which means again it is estrogen dependent, right? Melasma is a common harmless skin problem that causes dark patches or hyperpigmentation on your face. It is usually caused by sun exposure. When melasma appears in pregnant women, it is referred to as chloasma or the mask of pregnancy. Chloasma is triggered by hormonal changes that occur during pregnancy. These are all clear things, and I'm sure you all know that. I'm not saying anything new, but we are just trying to go in a proper order so that even in our brain, everything is proper order and we know how to manage these cases, right? Now, the other day also, Dr. Manisha as well as Dr. Mahekar told us the difference between epidermal and dermal melasma, how you try to separate and then see spots in between, or it is diffuse. But basically, if you look at epidermal melasma, it has a dark brown color, remember, a well-defined border. It is simple because epidermis is the upper layer. So anything on the upper layer will have more color. Hold on.
हॅलो 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 नाही येत आवाज नाही जात. हॅलो हॅलो सचिन नाही येत आवाज. हॅलो प्रॉब्लेम आहे वाटतं काहीतरी, आवाज नाही येत आहे.
Sir, we can hear it now.
हॅलो
नाही जातच नाही.
हॅलो
फुल आहे पण फुल आहे.
आता विशालकडे आलो चेक करायला. तुम्ही कडे जाऊ परत.
Can you hear me?
आता येते कसं काय?
हा आता येतोय आवाज.
Hello, can you hear me, all of you?
आता येते ना बरोबर.
येस सर.
Yes, sir.
विशाल
Okay.
बस सडनली कसं काय?
Okay, so can we all resume? Can you please show me some thumb, all of you? Am I audible now, all of you? Okay, fine. Thank you very much. So we are trying to differentiate between epidermal and dermal melasma, right? So something which has got a well-defined border, this is very, very important. This again will be a differentiating factor when you are differentiating hypopigmentation of tinea versicolor and pityriasis alba. Because pityriasis versicolor will not be a well-defined border. In pityriasis versicolor, there will be a well-defined border, but tinea alba will be kind of a blurred. Are you getting it? So in hyperpigmentation or hypopigmentation, it will be one and the same, right? So epidermal melasma is a dark brown color, while dermal melasma is light brown or bluish color. A blurry border appears no differently under black light and does not respond well to treatment. Now this is where exactly our homeopathy adjuvant to cosmetology will really work better. So any peel that we are using, any chemical peel or any peel which we are using, which is mixed with homeopathy, can surely make a big difference along with internal homeopathic treatment. Okay. Now we look at this. I was just looking through the internet and I found this very nice thing. Can you all see this now? So melasma, the skin condition, hyperpigmentation, where the causes are either sun exposure. There could be many medications. Now remember, when a patient comes to you with melasma, don't only think of sun, don't only think of alcohol as far as males are concerned, but also think of medications. There are many medications that can cause melasma or chloasma genetically also. The mother, the daughter, we could have kind of a genetic makeup whereby they are prone to melasma. Hormonal, as we already discussed, during pregnancy or during menopause when they are on HRT, that is hormone replacement therapy. Pregnancy. The most important thing is sun protection. Of course, one of the most important treatments that we always tell people with who are so conscious of their face is sunscreen, which is SPF more than 50. Remember, very very important. Because the sun here in India, sun here in Mumbai, sun in Nagpur, sun in Ahmedabad, really very very strong. Remember, since we are at the tropical part of the equator, remember that's where the sun rays are the maximum, and therefore all your patients you have to say moisturizer and sunscreen must, very important. Wearing sunglasses, wide brim hat. Of course, now you cannot use hat here, but still, if you want, you can use an umbrella or you can use a hat. There are a lot of topical medications. Remember, one of the things that I always tell my patients is Berberis equifolium. Now, Berberis equifolium in boric. Boric's materia medica is clearly given that it clears the complexion. Now, anything I always tell all my students that wherever you have boric, and if you look at the boric chapters and each remedy in italics, any remedy which is given in italics is worth ₹1,000,000. Remember, because that after using that particular symptom in the patient, you are going to get 100% result. So those who are practicing homeopathy as well as those who are practicing general practice, please keep Boric with you. Because Boric is the book for general practitioners. Because Boric is a clinical material. That's why in the various symptoms he has given diagnosis also, and he has given symptoms just like how they are given in medicine books. So therefore, please read Boric. Don't forget to read Boric and Allen Skin. Okay. Of course, there are a lot of cosmetic procedures also, but this is what, as far as this picture of melasma, really impressed me. Okay. Now, what is a blemish? Now, blemishes are something that occur as skin discoloration or dark spots, generally caused by acne breakouts. That means when acne they either rupture or you pick them out, whatever the discoloration remains behind is known as a blemish. They can also be attributed to factors like hormonal imbalance, genetics, improper skin care, poor diet, sun exposure, and aging. A blemish is any type of mark on the skin. Most blemishes are harmless. Now remember, this is very important. But you can't always neglect a blemish, remember. But people may choose to treat them for cosmetic reasons. Certain types of skin blemishes may become serious. Remember, there could be, as you can go as far as cancer when you think of a blemish, but not always, remember. But you should always keep that in the mind. An overproduction of oil by sebaceous glands can cause blemishes. Hormonal changes often trigger this overproduction, such as puberty. Excess oil can mingle with the dead skin cells, dirt, or bacteria. This results in pimples, pustules, blackheads, and whiteheads to form. So, right in the beginning, it could be a just a hormonal change causing excess oil. And if you don't clean your face, this excess oil will mix up with the dead skin cells, dirt, bacteria, and then it will lead to the blockage of the glands or the blockage of the ducts, leading to pimples, pustules, blackheads, and whiteheads. Okay. So basically, when we are talking of a blemish or we are talking of a freckle or any type of this hypo or hyperpigmentation, we are looking at the morphological aspect of macules. Remember, this is what is the basic of any dermatology course. That don't go directly to diagnosis that this is lichen planus, this is psoriasis, this is tinea. First, try to find out whether it is a macule. Now, macule is something like a patch which is less than 10 millimeters in size. Okay. This patch, if it becomes more than 10 millimeters, then it is different, remember. So there is something called macule, then there is something called papule, which comes above the skin. That papule, when filled up with pus, can become a pustule. So if you look at dermatology or rather cosmetology in this aspect, such a patterned aspect, then everything becomes very simple. Okay, it's like I was reading The Spirit of Homeopathy by Dr. Chaukkar long time back because it was his first book, and in which he said that German people, they are known for their exactness. So whenever we say that this product is from Germany, we are so sure that it has to be perfect because Germans, if you have to understand the rubric fastidious, it has to be Germany, you know, because Germans means fastidious. Everything very, very proper. So it's like when they made the Mercedes car when it is the manual which is made for repairing, if there is probably any repairs, which is very, very rare, but then everything is given in tabular pattern. How one part is related to another, how the repairing has to be done from one part to another. Such is the fastidious. So this is what is very, very important. We have to understand every remedy. You have to understand every pathology in such a way that we have it in our brain straight away. Okay, this was the thing, then this happened, then this happened, then this happened. My treatment has to be this. If everything is clear in our mind, clarity of mind is there, then there is no problem. There is no aggravation. Aggravation happen when there is a mismanagement in the mind or when we are in a hurry. So don't be in a hurry to do things. Be very, very systematic. Okay? What are the different types of facial grimaces? This is another thing which I like. There are different types: blackheads, papules, nodules, hyperpigmentation, melasma spots, scars, acne, whiteheads, cysts, age spots, birthmarks, cold sores. So many types of facial grimaces. Pimples, pustules, blackheads, and whiteheads can be categorized as blemishes caused by clogged pores. The unsightly blemishes can appear anywhere on the body, but most commonly on face, neck, shoulders, and back. Okay, this location is important. Lastly, we come to something called freckles. Now, freckles are small, flat brown marks. Again, they are flat. Remember, I told you about macules. Remember, macule and papule. You should be able to easily look at it because the same thing could be anywhere, and there could be a skin tag or there could be a wart. These are the things which are coming up on the skin. So the management will also differ. Remember, the freckles are small, flat brown marks arising on the face and other sun exposed areas. The color is due to the pigment accumulating in the skin cells. This is excessive accumulation, again overproduction, psychotic mild. Remember, okay? They are tan, red, light brown, or dark brown. Freckles are extremely common and aren't a health treat. They are more often seen in summer. You are more likely to have freckles if you are lighter skin and have blonde or red hair. Now remember, you see most of the foreigners many times, especially the Britishers. Americans are not so as fair as Britishers, but if you look at Britishers, they are very, very fair, and these spots, they come. Even Canadians, because Canadians have a British lineage, right? So there is always these spots. Freckles are so very common in this, right? There are small brown spots on your skin, often in areas that are sun exposed. The dark spots on the skin develop due to clustering of melanin producing cells within the skin. They are harmless and usually caused due to excessive sun exposure or genetic inheritance. They differ from moles. Now, this is one common question that comes to our mind: how do you differentiate between moles and freckles? Because they are flat, remember, they are not appearing raised. If you look at moles, they are always raised. When you touch is a very, very important thing. Without touching, you will not be able to know that this is a mole or a freckle. Remember, they're very, very common, especially lighter skin tones, and are more of cosmetic concern than a medical. There are two types of freckles, epaulettes and solar lentigens. Epaulettes are most common, reddish and small in size, can be genetic or sun exposure, while solar lentigens are age related, that are larger and darker in color. So these are the two different types of freckles. I don't think really in the treatment aspects it really makes any difference. As far as homeopathy, no, it does not make any difference. Remember, you ultimately you want to select homeopathy either constitutionally or specifically. So either way, it doesn't make any difference. But remember, the response is always with a pinch of salt. You cannot tell the patient that, okay, I'm giving you homeopathic remedy and it will suddenly work. If you are using a cosmetological procedure, yes, you will have more positive results, 60%, 70%, 80%. With homeopathy, you can have around 40% or 50% overall. Okay, so it's very, very important to meet to the expectations of the patient, especially when you're doing cosmetology. Remember, because everybody wants a fair skin, everybody wants a beautiful skin, everybody wants to look like Aishwarya Rai. But you have to understand that every person has a typical makeup, a typical constitution, a typical tendency, a typical susceptibility to a disease. Remember. So not everybody can become as beautiful as Aishwarya Rai, right? But we have to explain to the patient and we have to come up to the expectation that I can do up to this level, not beyond this level. Everybody has limitations, remember, and these limitations are very, very important to be put in front of the patient, frankly. Because if we are just interested in making some money, interested in giving only, just want to give result at any cost, that will cause chaos and that will cause damage. And that's what, in fact, most of the people who ask me while doing cosmetology course, की सर हनी हमारा cosmetology practice करता येईल का? Practice तर of course करता येईल तुम्हाला, but it is not a license, remember. This is, I've been talking to you for a number of years together to my students that you have to be good in what you're doing, then you will do the best, remember. If you don't know what you're doing, then you will fail for sure. Because you may pass here and there, you may give some results here and there, but if you're not to the depth, you know the topic. So please keep reading, 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 keep practicing, 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 and then jump into the water to swim. Don't jump in the water without knowing swimming. That's what I'm saying. This cosmetology course also I have designed specially for all of you so that you can have lots of practice in this. And that's why I'm especially arranging some offline sessions also along with the 3-day training, which we want to keep at the end of the 3 months. Remember. So make the most of this. I want most of you who are at least around Bombay and Bombay regions to come and do even once you see. Last time there were some ladies who had come from Panvel and from Nerul and from Palghar also, and you understand the difference between online and offline. Remember. So as far as possible, try to come at least once a week if you are able to come. If you are nearby somewhere in Bombay area or outside Bombay, try to come. Those who cannot come, of course, I have kept special training for them. Don't worry. You will get all the training. You will be getting all hands-on training when you come here. After 3 days, I want you to go out from here saying that, okay, sir, tomorrow I can do some procedure. This is very, very important. Those who are already doing procedures, they don't know, they don't need all this, but especially those who are going to start some, right? So they differ from moles and other dark skin patches in that they lay flat on the skin and do not appear raised. They are very common, especially in lighter skin tones, and are more of cosmetic concern than medical. Remember, freckles is not a medical concern; it is a cosmetic. We already talked of affiliates and solar lentigens. Okay. Treatment of freckles, of course, different type of solutions for fading freckles. Now remember, even the allopathic books, even the internet says consider for fading freckles. It's not written for curing freckles or to making your complexion clear. No, nobody said that. It fades freckles. So IPL is there, which you all know, IPL rejuvenation, laser treatment, chemical peels, topical retinoid creams, and natural. Now, out of this, all the first three are the procedures, right? Which we'll of course learn in our lectures. We're going to have a lecture on laser treatment. We'll have a lecture on chemical peels, IPL, etc. We'll also have a lecture on the topical treatments as far as cosmetology is concerned. But what is interesting to me, other than homeopathy, is also natural remedy. Now, remember, yesterday I was just going through it and I saw that there are so many things which are available in our home, in our kitchen, that we can use for this hyperpigmentation of the skin, right? One of them is apple cider vinegar. I'm sure all of you ladies who are, in the kitchen, you are the best judge, you know all that. So apple cider vinegar is one of the best options to get rid of dark spots. Have you all used them, anybody? If not, you can try it. So it contains malic acid that exfoliates dark skin cells and lightens the freckle. Now this malic acid is one which can dissolve, remember. Vinegar reduces the hyperpigmentation of any type and also improves the overall appearance of your skin. Now imagine if you give this hands-on things to your patient. Patients always like something which is, immediate hands-on. घर पे जाके मैं क्या करूँ? Giving them treatment, giving them creams, giving them procedures. Yes, these are all important things as far as doctor is concerned. But if you really want to be friends with the patient, if you really want to develop a rapport with the patient, remember, kitchen is the best thing. Just tell her, अरे आज kitchen में आप जाओगे ना तो जरा ये ले लो और ये लगा दो, and she'll be very happy, remember, and she'll be your patient forever. This is what, of course, I don't talk about kitchen because I am rarely in the kitchen. But when, the moment I started going in the kitchen and helping my wife probably, I started seeing that there are so many things that are useful in the kitchen. So because all these things, remember, you are all ladies, so I know that as ladies, you know that our spices, our things in the kitchen, they are so useful that there was no cosmetology so many years back, right? maybe 50 years back, 100 years back. Cosmetology, yes, Shringar was there. People used to apply something on the face to make themselves beautiful. But there were so many things from the kitchen which was the commonest is turmeric, right? Which we use now also. During marriages, we have haldi ceremony where we use to make the complexion so good. And that's why nowadays we have face washes which are made up of turmeric. Huh? Then we have got a mask which is made of turmeric. We have things in which we add turmeric. So turmeric we know is the best thing that can make you fair. How to use it? Don't use vinegar directly. Remember, it can damage the skin. So use it with honey. Apply it on the freckles. Leave it for 15-20 minutes. Then anybody wants to say something? Somebody has opened the mic. Dr. Komal, your mic is open. Do you want to ask something?
No, so by mistake happened.
Okay, fine. Thank you. So that is how apple cider vinegar could be useful. Okay, so something as small as apple cider vinegar is coming to our use. That is very okay. Next is lemon. Lemon, you know, lemon has an inherent tendency to remove stains anywhere. We are using lemon so very well in cleanliness in our washing powders, which are even washing clothes. It contains lemon. Any stain anywhere can be removed with lemon. So we can use this technique. Most effective and organic component. It also contains some kind of acids, which will tend to take away the hyperpigmentation. So it aids in lightening the freckles and other skin pigmentation. Lemon juice is rich in vitamin C, which you always you use. With so many procedures, you are using vitamin C. So lemon juice is rich in vitamin C and antioxidants that reduce melanin production and lightens the freckle affected area. It has anti-pigmentary and photoreactive properties that protect against harmful cells. How to use? Simple. Mix a couple of drops in honey, apply on freckled skin with a cotton pad, leave it for 15 minutes, rinse it off. Follow up with a moisturizer, repeat twice a week for best results. These are things which are easily available. Remember, why not give them to the patient? Why not make the patient empowered? Make them empowered. Why do you want that a patient should be dependent on you? अभी क्या करना है डॉक्टर अभी क्या करना है नहीं जो आपके घर में है वो आप यूज करो. You can tell them, right? Okay. Third is turmeric, which you told. A pinch of turmeric can do various things for your hand. It contains curcumin or curcumic compounds that inhibits melanogenesis. Now you remember why in marriage turmeric is used, so that the bride and the bridegroom they look so beautiful, so fair, right? Melanogenesis means it reduces the excessive deposition of melanin in the skin that causes freckles. You can combine turmeric with other resources to get fast results. How to use? Mix just 1 teaspoon of turmeric powder with some milk. Remember, turmeric and milk, and 1 teaspoon of lemon juice. Mix these until it forms a paste. Leave this on for 20 minutes. It's like a mask. Remember, natural mask. These are the things which are always existing. Remember, cosmetology has come recently, but these are the things which are existing always. Rinse your face with lukewarm water. Do not forget to apply a moisturizer. Always important is after any procedure, after anything that you use, apply a moisturizer. Almond oil, very very important. You know the qualities of almond, very very important for brain, very very important for skin. So almond oil is an essential and excellent oil for skin. It is rich in vitamin A, and you know how vitamin A is so very important for skin. So have everything that contains vitamin A. We always talk of carrots for vitamin A, carrots for eyes only. Why not for skin? So vitamin A, vitamin C for skin. Vitamin E, we have so many times we see doctors giving Evion 400, to the patients. Empirically, remember that. But you have to understand how vitamin E acts, right? So that nourishes the skin and reduces pigmentation. Almond oil works as a tonic for your skin that softens and brightens your skin. How to use? 2 to 3 drops. Apply it on the affected part with the help of fingers. Leave for about 1 hour until the skin fully absorbs the oil. Rinse it with lukewarm water. You can also keep the oil overnight on it. Even if your skin is oily, remember almond oil is not very oily. You can really keep it. It's not just like coconut oil, which is very oily. You can keep it, but especially if you have a tendency to acne or oily skin, try not to keep it overnight on the skin. Okay? Next is aloe vera, which is again very very important. We can grow it at home. Aloe vera contains aloe in that it works effectively to reduce skin pigmentation. You can use aloe vera straight from the plant or can purchase aloe vera gel from the market. Why purchase from the market? You can grow it in your balcony, right? It stimulates the production of metallothionein in the skin that can prevent damage by sunscreen. So it is like a artificial, it's like a natural sunscreen, right? Whenever you go out in the sun, maybe you can apply a little bit of aloe vera. How to use? Massage your face with aloe vera gel for 5 minutes daily to get rid of freckles. Wash out with lukewarm water after leaving it for 10 minutes. Honey. Raw honey contains bleaching properties that help to lighten pigmentation. To incorporate honey into your skincare regime for reducing pimples, here is what you need to do. Combine honey with either sugar or salt to make a scrub because it has to have that scrubbing thing, right? Rough thing in order to slowly exfoliate your face and freckles with the scrub. Wash with water. So imagine take little quantity of honey, put either sugar or salt to make it little gritty. When it becomes little gritty, you can apply and actually rub it and exfoliate your skin. Such a nice idea. Okay. Buttermilk again can be made easily, common kitchen ingredient, effectively utilized to reduce the appearance of freckles. Buttermilk contains lactic acid. You're using the lactic acid pill, remember? Buttermilk contains lactic acid that helps to lighten the freckles. Chas, commonly the chas or ta or uh, matha. Additionally, buttermilk makes your face soft and supple. How to use? You can use the buttermilk directly onto your skin. You can also take it internally. Remember, internally also it will give you the same effect. Leave it on for 10 to 15 minutes, then wash off with warm water. You can also combine buttermilk with oat milk to make a mask. Remember the oats that we eat. Remember, you can put those oats in buttermilk, make a mask, and then apply, keep it for some time and wash. Eucalyptus oil. Eucalyptus oil is an essential oil that has been proven to prevent melanin synthesis and tyrosinase activity. It decreases the hyperpigmentation of the skin, minimizing the development of freckles. How to use? Few drops of eucalyptus oil with any carrier oil. Apply this oil blend to your face. Wait for 15-20 minutes. Wipe off with a wet cloth. Follow this skincare routine every night before you use. Eggplant or brinjal, or bangan that we use commonly, right? Eggplant contains antioxidants, phenolic acid, just it can reverse the damage caused to your skin by harsh sunlight. Additionally, the typical feel of eggplant when we have it in our hand or when we are making bangan ka bharta. When you actually put it on the fire and how it becomes so softy and inside it is so soft. That itself is the doctrine of signature of eggplant. How it is good for skin. It makes the skin as soft as that when you do it. Remember. So additionally, eggplant has been found to be quite effective in reducing the appearance of freckles. How to use? Just slice an eggplant, rub one of these slices on your face in circular motions very gently. Allow the juice of the eggplant to work on your skin for a couple of minutes. Wash off. Do this every minute. I'm sure all of you know all this, right? So, as I've told you right in the beginning, I just want you to keep it patterned in your brain so that you remember when you have to do it. And use it daily. Remember, once you use it daily, it will be a habit for you to, first of all, you can use it on yourself only. And actually, I really feel that you don't need to have freckles or melasma to use such things. Natural things can be just used to bring a glow on your face. Remember. So you don't have to have melasma or anything on their face to increase it or decrease. Just use it naturally. Okay. Cocoa butter, one of the last things. Skincare enthusiasts love to use cocoa butter based product during harsh winters to make their skin soft and supple. Of course, there are no harsh winters here, but cocoa butter is a famous thing or a very, very required thing in Western countries. But aside from deep moisturizing, did you know that cocoa butter also has a capability to reduce freckles? It is enriched in bioactive compounds and offers considerable photoprotection similar to eggplant. It balances melanin, treats hyperpigmentation, and reverses sun tan. How to use? Take a coin-sized compound of cocoa butter, apply it gently on your freckles, massage the cocoa butter, leave it overnight on your face, like a sleeping mask. Please keep yourself muted. I don't know why you have to unmute yourself if you don't have to say anything. So please keep yourself unmuted, all of you. Okay? Unless you want to ask me any question. Dr. Dr. Palande, is your Dr. Palande, your your mic is on. Can you mute yourself, please, sir?
Mic is on. Should I on my mic?
No, it is already on. Can you mute yourself because it's kind of disturbing. Thank you.
Welcome, welcome. करायला सांगा फक्त प्रेझेंट घेतली
तुमचा माइक ऑन आहे सर अजूनही. Ravi, are you there, Ravi? Okay, fine. So by mistake, maybe he had clicked it off. Now let us think of homeopathy. As I have told you, these were the natural things. So today's lecture, basically, my aim was to bring to your notice that this is one of the commonest problems that you will see in your clinic. Secondly, as in cosmetology course, we are going to, make you prepared of how to tackle this problem of melasma, which is so common. Melasma is one thing, acne is another thing. Remember, hair fall is the third thing. So these are 3 or 4 things which come very, very commonly to warts or wart removal or stains or depigmentation. All these things are there. But these are the commonest things. So you should be armed with everything which is available to you so as to give the best results to the patient. So first thing is the cosmetological procedures which will be taught to you and you will be very good at that. Second thing is the natural things that are available in the kitchen which you can tell the patient to use anytime when they want. Third thing is which will come to your aid is homeopathy. Now, as far as homeopathy is concerned, I want to tell you again something called psychodynamics, that why is the face affected. Now, what is this face to you? Remember, why is face so important? Why is the face affected? Why has nature selected the face? Can anybody say something to it? Do you think this is important to think, or do you think that freckles and it's only the sun that is causing the problem? What do you all feel? Let's make this more interactive. Dimple, you are the one who said that you practice complete classical homeopathy, right? So can you tell me what could be the cause of freckles or pigmentation
The
on the
face
skin?
is the mirror of mind.
Who's this?
Dr. Meeta Patil.
Dr. Meeta. Yeah, please tell me. Face is the
Face
mirror
is
of
the
the mind.
mirror of mind. So what is going on in the mind will be expressed on the face.
Very good. So can you give me some example? Do you know any example, or have you seen any patient coming to you, or have you, आपण कधी आवर्जून विचारलंय का पेशंटला का फक्त मेलेस्मा झालाय तर आपण मेलेस्मा म्हणून ट्रीट करतो का त्याला विचारतो सुद्धा की बाबा तुझ्या लाईफ मध्ये काय चाललंय, कुठे तुला टेन्शन
Yes,
आहे का,
yes.
कुठे स्ट्रेस आहे
We
का?
definitely ask, sir. We ask, na?
Okay,
What is going on?
what would you get in patients of melasma? What would you get? ते तुम्हाला काय मिळाले? तुम्ही लोकांशी बोलला
म्हणजे
असाल,
पेशंट बऱ्याच वेळा हाईड करतं.
हाईड करतो, बरोबर.
तो विचारल्यानंतर म्हणजे जे काय आहे, जे मनामध्ये आहे पण ते बाहेर येत नाहीये, तेव्हा पेशंट एक्सप्रेस करतं आणि खूप काही गोष्टी समजतात.
एक्झॅक्टली. आणि एवढं लक्षात ठेवा की जेव्हा पेशंट काहीतरी हाईड करतो ना, तेव्हा त्याला असा प्रॉब्लेम होतो की त्याला हाईड करावा लागतो.
राईट.
आता मला समजा माझे काही प्रॉब्लेम्स आहेत जे तुमच्याकडनं हाईड करायचे आहेत, मला प्रॉब्लेम सुद्धा असा होईल जेणेकरून मला तुमच्याकडनं हाईड व्हावं लागेल. मेलॅस्मा आल्यानंतर लोकांना हाईड करावं लागतं, त्याला आपल्याला काहीतरी लावावं लागतं किंवा कन्सिलर लावावं लागतं. Yes, Dr. Urvashi, sorry, I'm sorry. So the thing is that when you get a pathology or when you have a particular set of mind symptoms or you have got a particular mindset, that will give you a pathology that will make you do it more. Are you getting it? So a person who's concerned too much about appearance, if you look at the remedy lachesis, which is the commonest example I give when I'm teaching, lachesis has too much about self appearance, how they look, they have to look the bird, so putting makeup and putting everything they like. but they will come up with most of the problems of acne, hair fall, which will damage their appearance. Remember, and this is how body works. Remember. So the most important thing is through homeopathy as well as through counseling, you have to convince all your patients that you are best, you are beautiful. You have to consider yourself beautiful. Because till the time, Dr. Palande, again you have unmuted. Mic na unmute na karo, sir.
Can I talk regarding this little bit?
Yeah, sure, sir. Please, sir.
So, in my many years of practice, I have seen psychoneuroendocrinology axis plays best role to give us these types of presentation.
Yes.
So, along with your classical guidance of natural remedies, we can heal the patient from psychoneuroendocrinological axis, and we will give the permanent result along with our cosmetic treatment and advice. The excellent example for this is sepia. Continuous quarrels with husband, indifferent love for the husband, lots of responsibility of female due to overwork, husband is drunker or is not taking care of the family, stress of economy and bread and butter. She become male of the family. So male type of female pelvis. And many things like this affects her mind, and that reflects as a plasma. So unless and until we are not treating the psychoneuroendocrine axis, we will not get the permanent. Thank you.
Perfect, perfect, sir. Very nice, very nice. So Dr. Rajesh has been practicing for many years, a good friend of mine, and this is what happens. If you use homeopathy in such a way, in such a classical way, and understand the patient right from the core, this will give us 100% result. And this is what we have to aim at. Remember, all of you, my friends, we are all the same. Remember, nobody is a teacher, nobody is senior, nobody is sir here. Everybody is the same. We are all homeopaths, we are all doctors, we are all good human beings. We have to be good human beings. So the first thing is, as I was telling you, with our homeopathic medicine, the perception of the patient has to change. Remember. So as Dr. Rajesh gave an example of sepia, the sepia thing, it always starts with too much of, overwork, too much of dancing. Dancing is one of the rubrics of sepia. Dancing म्हणजे काय? अरे कुठे कुठे नाचतेस तू? किती काम करतेस तू? How much you're working from here, there? There was one movie called Hum, if you have all seen. In that Hum movie, there is this lady, Deepa Sahi, who's a bhabhi of Amitabh, and she's a wife of Rajnikant, and she's bhabhi of Govinda. And there is a little girl also. And right from morning when she gets up, she's running here and there, running here and there, running here. Do you all remember this shot from Hum picture? If you have not seen, please see this. The way she's running. Amitabh says that, okay, give me this. Her husband says, give me my dress, give me my belt, he's a police officer. Govinda says, give me milk for my exercise. The girl says, give me my tiffin. And she's running here and there, giving everything to everybody. This is the dancing also. Remember. Dancing आपण जे rubric use करतो. Dancing amulets in CPR. So एवढा dance करून सुद्धा ultimately काय होतं? There is no reciprocation. She's doing it for years together. Nobody acknowledges it. Nobody values it. Nobody just says anything. Nobody even says one thanks to her. And this is the evolution of CPR. So it starts from too much care for others, too much anxiety for others, too much anxiety for family members, too much anxiety for loved people, alternating with indifference. So when we look at CPR, we look at all the symptoms of indifference and sitting alone, not doing anything, lazy, all these things of CPR we know. But why do we wait for a lady to go to this level? That is very, very important. We have to catch people in the first stage of the pathology, remember. That's where we have to catch. So CPR has to be caught when she's really caring for the family. Don't wait for her to become indifferent. Are you all getting it? This is very, very important. And why she develops this is because again the maleness, because she has to be the male of the family, isn't it? Another thing, another common example I'll give you is of the other day I saw a lady with a male pattern body. Now, hair fall has alopecia. There are 40 different types of hair fall, and there is a male pattern baldness and female pattern baldness. And the female pattern baldness is a typical type of female pattern baldness where you see this Christmas tree pattern, the central mang is there, that increases, a lot of thinning on the side. This is a typical female pattern baldness that we see. In male pattern baldness, you see typical M shape, then you see like this. In me, you see there is baldness here, there is baldness here. So it is a kind of a M pattern, and there is thinning here on the vertex. Okay. Why would a lady come with a male type of baldness? Because she has taken up the male role in the family. That's why you see this kind of baldness is so common in ladies nowadays. Why is PCOS so common in the ladies? Because of the competition. Because the thing that, oh, we want to work with males like this, right? All the ladies are becoming so very independent, coming into corporates, coming and working like males, so many hours together. But what happens is the balance. Remember? When they are not able to maintain the balance, because lady is made. Now remember, I am not a person to, and maybe this is not the right place to talk like this, but the important thing is maybe ladies are made for a particular work, made for a particular job. Their anatomy and physiology is made for a particular. I hope you all agree with me. I am not talking anything biased. I am not male bias or female bias. I am talking of physical physiology and anatomy of a female, physiology and anatomy of a male. Not that they are not supposed to work, or not that I am a hypocrite saying that they have to be. The important thing is they are working, but work, and no balance then causes the problem. PCOS, infertility, all these problems come when there is an imbalance, remember, not when there is balance. There are people, the ladies who are balancing home, they are balancing. You all are there. I'm sure you all are like that. Who are balancing home also, balancing practice also, everything properly, and nothing happens. But when you miss the balance, then the problem starts. So that is the pathophysiology. That's where you have to look at how melasma develops. Melasma is also on the face. Remember, what is face? तू मुझे अपना चेहरा मत दिखा, वैसे हम लोग बोलते हैं, है ना? We also say अपना मुंह काला कर दिया तूने, है ना? So when you're talking of face, what do you talk? You talk of dignity, you talk of values, you talk of इज्जत. तूने मेरी इज्जत कचरे में मिला दी, अब मुझे अपना चेहरा मत दिखाना. चेहरा दिखाना माने क्या? What is चेहरा दिखाना? What is face? Face is your value. Face is your dignity. Face is your. This is the first face value you say. Don't take him on the face value. So face gives you value. So anything that happens to your value, anything happens to your, गिरेबान, अपने गिरेबान में झाँक कर देखो. अपना मुंह काला कर दिया उसने. मुंह काला कर दिया माने she did something that is so shameful that अभी अपना चेहरा मत दिखाना. So these small dialogues which I am using, they are very, very useful. They are very, very pregnant with meaning. Remember, why do we always say मेरी नाक काट दी? नाक काट फाट गया है. In Marathi we say. In Hindi we say इसने मेरी नाक काट दी. Why there is certain position when you sit? We say Platina always sits with her chin upwards. Thanks to Dr. Ajit Kulkarni's book, and there are a lot of books on body language where we know that how these people sit. Platina would be sitting like this. Even Lycopodium. Why Lycopodium sits like this? These are all things that is the language of the Vaticanus. Remember, if you use this language and if you see how the patient is sitting, so not only what we give in form of homeopathy, cosmetology procedures, or whatever we give is all good, but also just look at the patient, what he is doing, what he is speaking, what are his gestures, why is he doing, why is he making his hands like this? Why is she hiding her freckles? She has come to you with a lot of cream concealing under it. Yes, I cannot face anybody. Why don't you go behind and find out, has there anything happened that she was ashamed of in her life? Not always, remember. Not always. Don't always ask any leading question like that. That are you ashamed of something or something? No, no, no. Please don't do that. This psychodynamics or this can be used only when you are not able to come to the remedy. Remember. If your remedy is clear, don't use it. But if your remedy is not clear, please try to think of this aspect of medicine also, which will help you. Okay. There is a book written by Louise Hay. Remember, there is a nice author called Louise Hay. Now she is no more. But from A to Z, for every illness she has written, there has to be some mental problem. कुछ ना कुछ इमोशनल कहीं ना कहीं हुआ है, तभी ये फिजिकल प्रॉब्लम आपको मिला है. That is very, very important. Okay. So let's look at the remedies, which all of you know for sure. So sepia. Okay. So sepia. Now we have gone into sepia, the psychodynamics also. We've seen how why sepia develops this melasma. So now you know that एक पेशेंट मेरे सामने बैठा है, अगर उसको sepia देना है तो क्यों देना है. अगर कुछ नहीं है तो स्पेसिफिकली सीपिया 30 भी दे सकते हैं. It will act. Remember, CPR will act on melasma in at least 50% of your cases. But what about the other 50%? So CPA is one
Sir,
of the
can I
top
add
remedies.
little bit?
Yes, yes, please sir.
The content of sepia cuttlefish ink is melanin and mucus.
Yes.
It also contains tyrosine and dopamine. So we are using this product for depigmentation. And such a classic homeopathy we are using in the minute doses, and we are healing the plasma with tyrosine and dopamine with the help of sepia.
Absolutely.
This is a great thing to be added.
Yeah. Absolutely.
Thank
Thank
you.
you, sir. Thank you very much.
Thank you.
So you see, it's like a homeopathic thing only, right? We are taking the CPR cuttlefish, which contains this thing, right? It contains melanin and all. The sac. The sac contains melanin. But also don't forget that CPR has a tendency to throw this ink and run away and hide somewhere. Remember when there is a danger. So think of this also when understanding a CPR patient. That कहीं पे भी जाके जो gloom हो जाता है. Because when they put ink in the surroundings, it causes all gloom everywhere. And that's why CPR creates a gloomy environment around. Number one. Number two, they have a tendency to hide or to go somewhere because they have to protect themselves from danger. So these all things you have to remember. Plus melanin itself, when it is potentized, that's why CPR becomes the top remedy. Because it is just the melanin which is potentized, along with other things, of course. There is a lot of other things, but melanin also is there, right? Here the pigmentation is more on the nose and cheeks, giving a saddle-like appearance. The face is puffy with blue rings around eyes. Very effective remedy for facial pigmentation that occurs during pregnancy. That's why chloasma. Menopause with irregular menstruation. Of course, bearing down sensation and a peculiar constitution of CPR, very, very important. Of course, aversion to milk. Remember some problems with mothers. Remember, I had read a long time back, I think in link somewhere, that all the remedies which have aggravation or aversion to milk will have some problems with their mothers. Remember, either they will have problems with their mothers or they have problems with their children being mothers. Remember. So this you can use in your practice. I have used it very often, so this could be a clinical tip for you. Many ladies come to us with aversion to milk. दूध पहले के बाद त्रास होता है, उल्टी सारखं होतं, कसर कसर होतं. I don't take milk. A little bit of milk and I get a lot of nausea. Why? Why? Therefore, a lot of lac humanums, lac maternums you are seeing nowadays. Remember, lots. Because of the corporate culture again, the ladies or the mothers have to leave their children to creche. They have to leave their children with their in-laws and they have to go for their job. Therefore, irregular breastfeeding, not feeding their children enough. So when the child really wanted the mother to be with her, the mother is not there. That creates a lack of bond between the mother and the child. So these things you have to go to this level and understand. Remember. Okay. Of course, indifference to loved ones. But I told you, this is not the beginning. This is the end of CPR. Don't catch CPR there. Catch CPR when they are very, very caring, when they are dancing, when they are doing everything for everybody without there is expectation, but they are not really sad or they are not really angry that nobody is giving them any acknowledgement. But they are doing. Catch CPR during that so that you can avoid her going to indifference, avoid her getting the melasma or chlorosis. Repeating it. Next remedy, Thuja. Again, Thuja very, very important, which acts on the skin. Thuja is a very, very important remedy for greasy face also, remember. Greasy face, lot of secretion of sebaceous gland, just like natrimum. So you got two remedies, Thuja and natrimum for very, very excessive oily skin. Therefore, they are also good remedies for acne, remember. So skin discoloration due to chloasma, light brown or red pigmented spots, greasy skin with brown blotches, patient experiences heat in the face. And of course, Thuja, you know the typical sensation of being, fragile. So they always going to talk to you कि अरे आप क्या लगा रहे हो, कुछ reaction तो नहीं होगा ना, ऐसा कुछ मत लगाओ जिससे मेरा face एकदम. So it's not about the appearance, it's about the whole existence. The feeling that they are fragile, that they are made up of glass. This is what was told to us in the classrooms, right? उनको ऐसा लगता है वो glass से बने हुए टूट जाएंगे. ऐसा कोई patient नहीं बोलेगा कि मुझे ऐसा लगता है कि मैं glass से बना हूँ और मैं टूट जाऊँ. But they talk के ऐसी मत दवाई दो जिससे कोई reaction हो जाए. ऐसी मत दवाई दो जिससे मुझे कुछ ज्यादा खराब हो जाएगा. Please don't give me something. Okay, so that is Thuja. Of course, Burberry's Equipolis #1. Remember, as I feel that it is one of the best remedies to clear complexion. Borix Multi Remedy का मैं clearly दिया है It clears complexion. It is a marked power for clearing of skin pigmentation to reveal clean, glowing skin. Now, if you see most of the ointments, most of the pomades, homeopathic pomades, whether it is SBL or HPL or whatever available, Baxter or whatever, every cream contains berberis, which has acne clearing as well as for face clearing creams. All of them contain. Even many peels nowadays contain berberis acne. So these peels, when they apply along with internal medication, will give you the best results. Berberis aquifolium is very, now remember it is aquifolium, not vulgaris. Vulgaris is the one for kidney stones or renal stones, remember. But aquifolium is for the skin. So very effective clearing of scars, chloasma acne, yellow brown patches in the face. Skin of the face may be pimply, dry, waxy, rough or scale. Effective for blotches and pimples. Okay. Sulfur, it's one of the best remedy. You all know that sulfur, whenever nothing will work, sulfur will surely work. Another effective remedy for skin pigmentation, good remedy for chloasma, has been treated with external application in the past. Sulfur patient may have dry, rough skin with pigment, unwashed appearance is there. The patient will always tell you, मैंने कितना भी अपना मुंह धोया, कितना भी face wash किया, फिर भी ऐसा लगता है जैसे मैंने धोया नहीं. So sulfur patient having dry, rough skin, pigmented spots, burning and itching on the face. With any skin problem, if there is a lot of burning and itching, think of sulfur, think of arsenic. Even for hyperpigmentation, remember, think of arsenic. Very important remedy for hyperpigmentation. Most suitable medicine for facial pigmentation resulting from cosmetic overuse. Remember, another remedy is Bovista. मैंने फाउंडेशन लगाया, मैंने क्रीम लगाया, उसके बाद मुझे बहुत सारे एक्ने आए. Think of Bovista. Think of sulfur. Remember, black pores may also be seen on the face, mainly on the nose and the chin. Okay. Phosphorus, top remedy for freckles. Remember, as that you know, phosphorus is for fair ladies. My fair lady, remember. So, a lot of fairness, a lot of freckles with tiny spot, especially on the nose area, worse during summer season. Of course, generally, if you look physical generals, craving for too many cold things and heat in the cheeks. So, of course, there is heat, just like arsenic, phosphorus, sulfur, you know, the trio of burners. Lycopodium, again, a top remedy for freckles, which is covered on the face. Skin may turn yellow or blue rings. Lycopodium patients prefer hot drinks and like sweets. Now, this is important. See, why every time a general symptom is added? Because if you use generals along with particulars, your results will be 100%. If you give only on particulars, maybe your result will not be 100%. So remember, at the same time, potency. When you are thinking of lycopodium and you are giving it only locally, your potency will be 6, 12, 15 or 30, not more than that. But if you're thinking constitutionally, if you're taking a general symptom into category, you may think of 200, 1M, 10M also. Okay? So think about homeopathy along with cosmetology like this. That how you're going to deal with the patient. What is the patient talking? Is the patient, that's why Dr. Shankaran had given us the level of sensations, remember, or level of potencies. Isn't it, Dr. Palande? That when to select which potency, isn't it? Are you there, Dr. Palande? Oh, I think he's gone. So, which potency to select at what level? What level the patient is at? When the patient is talking only about the diagnosis, when the patient says, "मैं मेरा acne से आया हूँ," so that means he's concerned only with acne. Then your remedy or your potency will be low because he's at a very physical level. जैसे जैसे उसकी level अंदर 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 जा रही है, वैसे वैसे आपकी potency बढ़नी चाहिए. So look at how the patient is talking to you. Even when the patient is making gestures. Now imagine many ladies or many gents will come to us, or many patients will come to us talking lot of hands, you know, lot of hands and gestures. मुझे ना डॉक्टर साहब ऐसे होता है, मुझे ना ऐसे दर्द होता है, मुझे ऐसे होता है. These are the things that they are going to do, and when they are doing these gestures, remember your potency has to be much beyond 1M, because he is right into the core of his problem. You cannot think of 30 there. 200 socho, 1M socho, 10M socho, very thin gestures. Badiyaga, very, very important remedy. Badiyaga is considered to be a specific remedy for pigmentation due to freckles. Cauliflower, very, very important remedy related to female sphere all the time. Cauliflower prescribed when the pigmented spots appear in the forehead. They are known as moth spots. A lot of leukorrhea seen in women with menstrual and uterine disorders. Don't forget cauliflower, very, very important remedy. Okay. Cimicifuga, again, facial pigmentation in young women. Amorca, good remedy for pigmentation due to freckles. Stout, obese, sensitive, and chilly persons leading to sedentary life. This violent itching and burning is present. Amonta are very important remedy for respiratory problems also. Lot of sinusitis, lot of epistaxis also many times, lot of nose blocks. Okay. Kalika, very excellent remedy for pigmentation due to freckles, especially after childbirth. Remember. After childbirth or loss of attitude. So ailments from also plays an important role. Ask the patient, कब से हुआ है? क्यों हुआ है? कब से हुआ है? क्या लग रहा है इसके बारे में? What is your main concern? Of course, most of the females, most of the ladies would say that it is the appearance that affects them. But you will have to go behind this. Remember, appearance is one part for sure that they have come to you, but there must be some other part. Natrum hyposulfuricum uses remedy locally and internally for removal of yellow brown spots on skin. Very important. Natrum hyposulf mother tincture. Okay, so think of this mother tincture. You can also use mother tinctures of calendula, echinacea, and berberis equifolium. You can combine these and you can tell the patient to apply. Now remember, there is also an aspect of psychology in this. When a patient comes to us, when you're giving internal medication, you're giving some cosmetological procedure, at the same time, if you give them something to apply, it really works. Whether it really works or doesn't work, it is a different thing, but it works. You know why? Because the patient feels कि कुछ तो लगाने के लिए दिया. That's why in cosmetology we got so many products. ये भी लगाओ, वो भी लगाओ, ये भी करना है, वो भी. Most of the times, if you're giving a good internal remedy, I'm sure everything is taken care of and all these things are included. But please do use it in your armament. Okay. So thank you very much. So that finishes our lecture on pigmentation. We will be doing a lot of other topics like this. We'll also do the psychodynamic aspects of every topic so that the flame of homeopathy stays alive. We don't have to उसको बुझने नहीं देना है homeopathy को. We have to all keep homeopathy alive with cosmetology and try to make the most. And as I have told you, give 100%. And please read Boric's Materia Medica all the time. Always keep Boric at your hand. Remember. Okay. Any questions? Anybody, please welcome. Any questions? Thank you, Mita. Anybody? Sulakshana, Made, any question? Kai question there? Thank you, Harpreet. Thank you, Rupinder. Thank you, Swati. Swati, any questions? Swati, right there.
No, sir.
I hope it was clear. Do you want to add anything? Do you want to add to what I've said? Dr. Dimple, any feedback? Okay, right. So thank you very much. On Thursday, we are going to have. Thank you, Urvashi. So we are going to have a lecture on mechanical exfoliation. We'll have some small demo also. So people who are in Bombay and around Bombay, please try to come. Otherwise, we're going to have a webinar and seminar together at the same time. And of course, all these things for the information of everybody. We all will be repeating this when you all come to Bombay. So I'm waiting eagerly for you to all to come to Bombay so that we can give you the best when you come in. Okay. So okay, thank you very much. Bye bye. Take care of yourself.
Thank you.
Thank you, sir.
Thank you.